The opportunity to examine the impact of Medicare's competitive bidding program for durable medical equipment. And before I make a few comments about that, I would like to, in a very respectful way, touch on some of the questions that your Rutgers political science class were asking you. All of us just came back from a 3-week district work period, and practically everywhere we went, people were asking questions about the recently passed health care bill. And almost all of them were unanimous in the fact that they did not understand the bill. They did not know when regulations were to be expected, when the bill would be completely into effect, and asking all sorts of questions that we really could not answer. And I genuinely believe that it would be to the benefit of the American people if this committee did start having some oversight hearings on that legislation, because it impacts every single person in this country. And I don't know of any legislation that's passed the Congress since I've been here in which people have been more confused than on this piece of legislation. And I know that the gentleman has the same concerns that I do, but I do hope that we would have an opportunity to start having some hearings about that legislation. Today we're very much interested in learning how this new competitive bidding program, this pilot project, is it really going to save Medicare money? And if it does, are we going to be able to maintain the quality of care for the beneficiaries? And I don't think there's any question but that we recognize in the long term we do have to do something about Medicare cost. Not just for the fact of saving money, but if we're going to continue to have a viable health care system for our senior citizens, we have to be concerned about the quality of care as well as the price. And many experts that I've talked to, and I'm certainly not an expert myself, and I really don't have any opinion about this pilot project yet, but many of the experts have said that they believe that this pilot program is poorly designed. They say they have concerns that the entire program could collapse under its own weight, resulting in drastically reducing the number of home care providers in rural areas particularly, as well as, instead of decreasing cost, increasing cost. And by having a 3-year contract combined with the fact that relatively few providers are deemed winners, results in fewer competitors the next time that bidding occurs, because there are going to be a lot of people who probably get out of this business. But less competition also in the future may very well result in higher prices in the future and mitigate the projected savings by CBO. And as I said, we all are very much interested in solving some of these problems of cost and improving quality of care. And I don't intend to be negative about this today, but I'm delighted that we're having the hearing to have a better understanding of really, is this going to work and is it going to be effective? And then I might also say recently some of us sent a letter to CMS asking that they provide a list of the winning bidders that won the first round of bids so that Congress might have the opportunity to examine those bids to see if those winners are in fact capable of participating in the program. And we only sent that letter a couple of weeks ago, so we have not had a response yet. But I want to thank you again, Mr. Chairman, for the hearing, and I look forward to the testimony of our witnesses, who I know will provide us with information that we need to get an objective view of this program.